Tenolysis, triceps. Tenolysis involves transection of adhesions that have formed between the tendon and its surrounding tissues. Beginning proximally along the supracondylar ridge and ending near the subcutaneous border of the ulna, the physician makes a deep dissection to the anterior aspect of the capsule. The triceps tendon is retracted posteriorly to expose the olecranon fossa, and tenolysis of the triceps and posterior capsulectomy is performed. Tenolysis should be performed under a local anesthetic so that full release can be confirmed. If, however, general or regional anesthesia is used, the physician may check the adequacy of the removal of all adhesions by manually pulling the tendons. Tenolysis, flexor or extensor tendon, forearm and/or wrist, single, each tendon. Tenolysis of a flexor or extensor tendon is indicated in the case of extrinsic extensor or flexor tendon tightness. In the case of flexor tightness, the physician approaches the involved flexor system through a zigzag incision that is long enough to uncover the length of the flexor. The physician excises all limiting adhesions, whether the excess scarring is located proximally in the forearm and/or distally in the wrist. The tendon involved is released of motion-limiting adhesions. The retinacular pulley system is preserved. During the procedure, the patient's active motion is re-evaluated. To achieve this, a local anesthesia is supplemented by an intravenous analgesic tranquilizer combination drug. After tissue closure, the physician applies a splint over the dressing. These must be applied in a manner that allows continued flexion to maintain the tendon's gliding action through the lysed scars. The above techniques are the same for extrinsic extensors, except there is no critical annular pulley system to preserve, although the sagittal bands must be protected. Tenolysis, flexor tendon, palm or finger, each tendon. Palm and finger, each tendon. The physician removes scar tissue to release a flexor tendon in a finger or the palm. The physician incises the overlying tissue and dissects to the affected tendon. The scar tissue is debrided and removed, freeing the tendon. The incision is sutured in layers. Tenolysis, extensor tendon, hand or finger, each tendon. Tenolysis, complex, extensor tendon, finger, including forearm, each tendon. The physician removes scar tissue to release an extensor tendon in a finger or the dorsum of hand. The physician incises the overlying tissue and dissects to the affected tendon. The scar tissue is debrided and removed, freeing the tendon. The incision is sutured in layers.